example, one of you and one of your friends has the same knowledge and even know how to take history, asking about the ID, asking about chief complaint, asking about present illness, anything. But one of your friends during this taking history show his prestige, show his charisma, attract the trust of the patient, but the other friend cannot show his charisma, prestige, discipline. And if you compare these two patients which contact with two doctors with the same knowledge, for sure this patient trusts more to this doctor. And you know that when the patient trusts to the doctor, the process of treatments for sure progress promotes better. It's real that whenever the patient trusts to you, what is trust? Positive thinking about the doctor, that this treatment respond, he or she can be better. So when you know that you can be better, the patient cooperates more. The patient is more emotional. So when the patient is more emotional, when the patient trusts you, the process of treatment goes faster, and even the patient feels better. And feeling better is a part of quality of life when you feel better. So these patients say when this patient and this patient are friends, said that my doctor is very good and very professional. But this doctor, even the same diagnosis, the same strategy, but the patient didn't make good communication with the doctor. Said that the doctor is not bad, but after a while, after 20 sessions, you will see that the distance between treatment response of this patient and this patient will be total. And at the end, even that patient maybe said that, okay, who is your doctor? Maybe I want to come to your doctor, and change his doctor. This is very important, making communication with the patient. And you should, this is an art, not just even a skill. It's an art, making communication with the patient. So, during taking history, at the end, me as your teacher, who should give you a mark, I look at you, me as an observer, because observer during taking history is the parents, is the family. A patient with a stroke come with his son, and the son look at you, and even if I trust to you, this is your property. Me as the observer see how much charismatic is taking history, how much fluency, discipline, prestige, how you could make communication with the patient. Did you success or not? This is very important. So, step by step, all of them has checklists. Your charisma, your prestige, your discipline, fluency. So, the first contact, the patient. And at the end, I will tell you what is the product of this taking history. So, the history should have a good structure. If your history has not good structure, it has a role in decreasing the trust of the patient. So, I want to give you the structure of the history, and then you will see what you should reach and what is the next step. What is the first question from the patient? Name. Very good. ID. ID include what? Name. age.
Job.
Wait, sometimes maybe it's necessary to ask, but it's not ID. Weight is in physical examination. What else?
Why did you come here today?
This is This is the next step. The ID, the personal characteristics.
The living, where do you live?
Very good. Place. Because sometimes you want to plan for the patient. Patient come to you. His home is in Nasiriyah. And you say every day you should come and I treat you. Sure. This is another step. Personal ID. Just about yourself. Just about the person, the patient. This is personal ID. What else? Phone number? Phone number the secretary should take. Very good. Very important. Sometimes you are taking a history from the patient who is a specialist in neurology, a neurologist. And you are talking with him very, in cheap way. Very important that what is the academic rank of the patient. So, and also maybe the job also important income. The patient is rich, the patient is poor. Because when you want to prescribe some strategies which is very expensive, and the patient cannot pay for that. You cannot say that, okay, this is my prescription. If you cannot do, it's on your responsibility. No, you should think that you are prescribing some strategies. Can the patient pay for that? You are tabib, you are doctor. You cannot say that, okay, it's not my fault that you cannot pay. Whenever any patient comes to me and I want to plan a strategy for treatment for poor patient, for sure I should think that what is the cheapest way for this patient. If you want to prescribe some expensive procedures, and you know that he cannot pay for that, the patient loses trust to you. Because you cannot say that this is my prescription. If you can do it, you will do it. If not, go and no. You are Hakim, you are Tabib. This is what you should understand. What is your role as a doctor? Very good. Exactly. Marriage. Let's start. Okay. What else? When the patient is alone, the patient is living alone, doesn't have any partner, doesn't have any children, no brother, no sister. It means that patient has no social support. Very important in planning. But the patient is living with parents, is living with, for example, an autistic patient come to you, no mother, no father, orphan. It's important for planning the treatment. You should know that for sure nobody is to bring him to you regularly. You should think how you should deal with this patient. A patient with a stroke has lost the job, no income, and his wife is dead. Children is living in another city. He's living alone, no support. So it affects on your strategic plan. This is, as I mentioned, taking history is an art. You should completely aware who are you dealing with. How is the situation of the patient? This is the first step. Okay, You are talking about the patient in the middle of taking history. Okay, I forgot. How old are you? See, the trust of the patient decreases because the patient understands that you don't have any regular structure for taking history. Your history should be a structure. At first step, after saying hello, even these are just questions. Saying hello, how to deal with the patient. It's important for me. How you are dealing with the patient. How? During taking history, maybe I give you some important points that during taking history you should pay attention to that. I'm waiting that you come here and see how you say hello with the patient, how you sit in front of your patient, how you touch, how is the discipline of your class. It's important, you should be very disciplinary. Your office should be clean, your house should be clean. This is very important. So,
doesn't matter is how introduce it with the doctor.
exactly, you should introduce. See, sometimes you are a very famous doctor, and it's not necessary to introduce yourself. But sometimes you are in a clinic, for example, in Al-Hadi Center, and this is the first time you should introduce yourself. I am blah blah, my job is blah blah, and I am here to help you. During taking history, I will look at you, how you want to attract the trust of the patient. This is what I don't talk about that. This is your art, and it's important for me. Even you ask all the things with checklist, you cannot bring here checklist. Remember, don't think that you can put right in paper and then start asking. No checklist. Maybe if you want to have this or you write here and you can switch from here, no problem. But no notes you are permitted to bring here. The second, after this ID, a lot of the students in past semesters forgot about asking about ID. First asked chip complaint. The next part is chief complaint. What is chief complaint? You mentioned
why the patient come to
exactly. What is your problem? How I can help you? Again, I will see what questions you will ask. It depends on your art. You should exercise that. How you want to reach. What is chief complaint? Chief complaints should be written by the language of the patient. What exactly he mentioned. I come here because of hand weakness. I come here because of problem in walking. I come here because of limb pain. I came here because of some restriction in movement. I came here because of gelling. Came here because of stiffness of my limb. Anything. Third question. So understand what is chief complaint, yes? The third part is present illness. It means that you should ask about this chief complaint completely. Chief complaint may be one sentence, but you should completely analyze this chief complaint in present illness. So, which questions you think that you should ask? You should ask the patient won't talk automatically. You should ask.
درد چجوریه کجاست چجوریه
Very good.
درست میشه
Exactly.
چه چیزی بیشترش میکنه
Very good. Onset. From what time it started? What time starts? The course. For example, I have limb paralysis from 2 years ago and it's fixed. Or progressive. I had a very mild weakness, but after a while it progressed. The course is progressive. Sometimes improved. I had very severe weakness, but now it's better, but still I have weakness. So onset, the course, what else? Location.
Duration.
Very good. What else?
پخش میشه یا نه؟
Character, very good. The character of the symptom.
Severity.
Severity, very good.
مثلا شدتش چقدر؟ از 1 تا 10.
Severity, yes. What else?
Previous treatment.
Hmm?
Previous treatment.
Previous treatment, we will talk about past medical.
Aggravating factors and relieving factors.
Exactly. Aggravating, as you also mentioned.
Relieving-
What makes it better? What it makes worse. Exactly. Associated symptoms. At the same time, anesthesia, anesthesia. This is present illness. Okay, what else? After completely analyze the chief complaint, we will talk about past medical. We are in taking history. Now past medical history, as you mentioned. Okay. Any illnesses. For example, I had hypertension. I had diabetes. I have some kidney problem. And also the medications during these times, which medication you use and what medication you are using for other illnesses. We call it past medical history. All of them you should have checklists. If you miss, you will have problem in planning of your patient. After past medical history,
Examination.
you mentioned. I said that it will be
اینکه تاثیر گذاشته بوده زندگی روزمره.
no family history. You mentioned
آره،
Sabah.
سابقه.
Family history. It's very important. Family history. What else?
چه درمانی انجام داد؟ نه.
Past medical.
The social situation.
Very good. Very good. About social situations. Social situation. Okay. So, what is social situation?
اینکه چه تاثیر گذاشته روی زندگی.
Exactly.
If we have
The effect of disease on the family, partner, and friends. And in the seventh, the effect of disease on the performance. Again, this performance is personal. Social situation, which is very important call it burden of disease. Again, remember that you are tabib. When autistic patient make mother depressed, you should think of the effect of disease on mother. Very important. When they come to you, don't think that the depression of mother, okay, it's not related to me. My patient is the child. No, because if you think about the burden of disease, the effect of disease on the family and care of the family, this care will transfer to the patient. You cannot believe that if you care depressed mother, if you treat depression of the mother, this mother help caring the patient and the quality of life of the patient increase. This is medicine. This is what the physicians should do. It's not just you learn some procedures in physiotherapy or anything. Very important. And performance, the effect of disease, this is very important. The effect of the, on what? Personal activity, very good. You should ask for toileting, for bathing, for eating. Can you do it independently or not? For example, in a patient with a stroke, you should ask. What else?
Academic.
Very good. If a boy or child, how is a school activity? Or if a student in your age, what else? Job and social communication. How is the communication of this autistic patient? How many friends does he have? Does he have good relationship, brothers, sisters? It's very important.
بعد اگه بچه باشید
If child, communication with brother, sister, father, mother, and friend. For example, a 6-year-old, 7-year-old autistic patient. How many friends does he have? No friend in the school. It's important. So, about performance. What else? What else? Which is very important.
What you would do for patient? What you would do for patient?
This is next step after taking.
No, I mean what you would say to patient, how I can help you, or something like that. How you
This is
can.
a chief complaint. One of the questions that for finding the chief complaint. The second, how can I help you? This is in past medical history.
I mean, I will tell the patient, I will do that, I will improve
This
your.
is the last. This is the last. The end. This is what you should explain. Here, still you need more information that you can explain for the patient.
The
Very
goal of
good.
the
At the
patient.
end, this is very important. What else?
Goal of the patient. The goal of the patient.
The goal.
He wants to come back to activity life, or is he a player or something?
This is what you should talk with him at the end. You get the problem list. Again, this is what you can ask in social. You are near. I understood what you want to mention. What? Lifestyle, not lifestyle. What you can ask, you are near.
Do you feel any change in his life, like his sleep, his appetite,
Very good.
all the systems like that?
Very good. We call it habitual status. Exactly. Habitual status. One thing you can say lifestyle. Habitual status. Lifestyle. Sleep. What else? Diet. We call it habitual status. Or anything the patients like to do as a habit. Understood? And another thing, if the patient doesn't mention to you till here, because sometimes it's chief complaints. For example, the patient is stressful. The patient is depressed. We call it psychological status. Very important. Sometimes maybe doesn't. You should ask. You should ask about emotion. Are you emotional? Are you motivational? Feeling. How do you feel? Are you sad? Are you upset? And thinking. Thinking positively or negatively. This is very important. In the past classes, I told you that if the patient is depressed, if the patient loses emotion, if the patient thinks negatively, it affects on the response of treatment. So it's very important. Maybe the patient during taking history, complaint, present illness, they mention to their feeling problem, emotional problem, thinking problem. But if not here, you should ask. Because if the patient is not emotional, is depressed, and thinking negatively, it completely affects all treatment response and outcome of your treatment. You should treat. In psychology, I told you that before any improvements in performance, you should improve psychological status.
Doctor, how can I be sure or trust the patient information?
Very good. This is another art. Do you know what do we call it when the patient telling you lie? We call it manipulation. Even very professional doctors sometimes are manipulated by the patient. A lot of cases. I had a patient that during giving a history shows himself very depressed and the social status is very, very bad. Nobody supports him, and everybody are trying to make problem for him. And you know that. What was the problem? Paranoid personality disorder. Completely manipulation. You should be very careful during taking this. As you mentioned, the patient can lie to you.
So how can I be sure?
Because
Someone, the lies are not about
attraction
psychology.
of attention of the others. He wants to attract the attention. In front of the others, is talking, telling lie. It is one of the most difficult part of taking
She
this.
said sometimes the patient lies, but he doesn't know that he lies.
Exactly.
So
This
what
is
you do
called
in this
blue
case?
ado.
This is not a
This is a type of delusional disorder he mentioned. Even sometimes the patient is telling lie, but believe that it's true. Very complex. I myself had this patient. We call it in psychology flou ado. It's a French word for the lies which patient delusionally believe on that. And conversion. What is conversion? My hand is paralyzed and completely think it's paralyzed. But when you check the force is normal. It's not telling lie. It's conversion. You cannot tell the patient, okay, your hand is normal, go. No. The patient completely feel that this hand is paralyzed. And even you cannot tell to the family that, no, he's telling lie. It's not lie. You know, in conversion, do you know what is conversion in psychology? We talked about that. In conversion, the patient completely feel that the hand is paralyzed, but all the neurons and the muscles are normal. But the patient feel completely this is paralyzed. But when you check in clinic, paraclinic, you see that everything is normal. So you are telling them, do you know what happened in next step? I told you in past semester in psychology.
Suicide.
Exactly.
Suicide.
Next step is suicide. We will see that the patient killed himself. Whose fault is it? Your fault. You should know how to deal with this patient. Yes, we have a term malingering. For example, you are in the class and you want to leave the class, and the doctor, the teacher doesn't let you, and you should go, oh, okay, doctor, I have a very bad stomach pain, I can tolerate the class, do you let me go out? The doctor for sure say, yes, go out. And after that, I lied, I cheated him. This is malingering for some tangible gain, material. But in conversion, don't think that these are conscious, conversion. No, the patient completely feels this hand is paralyzed. Do you know what is pseudo-seizure? You know what is seizure, Shema, yeah?
So what is seizure is when there is no seizure.
There is no epileptic discharge, but the patient is doing exactly like seizure. But for sure, a professional doctor, when see, you say that, no, it's not a seizure. It's not real seizure, but it doesn't mean that the patient is playing the role of seizure. The patient is completely unaware of what is happening. Very complex, psych is very complex. In pseudo-seizure, if you say that, okay, he's playing a role, and the family say that, don't play role, the next step is suicide. Very dangerous. And this is your fault.
Actually, Doctor, I confused between this different term you said.
Very difficult. But conversion, the patient is unconscious.
So how I can differentiate between conversion patient and real life patient?
So, we have a rule in medicine. You should never think that the patient is telling you. Never. Even if you are sure. Even if you are sure. Never think, okay, you understand that this hand is not paralyzed. So why he is telling it's paralyzed? So is it malingering or is it conversion? Never think of telling lie. You should consider, this is a conversion. And plan based on the conversion. Because as I mentioned, sometimes if you say there is no problem, the trust of the patient decreases, the trust of the family decreases. Just you should plan that it is conversion and I should work on that and continue. But you should never let the patient manipulate you. What is manipulation? The effect of manipulation, changing the way of your treatment. This is the only thing that you should be careful.
So the wrong diagnosis.
Exactly. Wrong diagnosis. This is manipulation. It's not related to you. Why the patient is telling lie. It's not related to you. What time I say it is important? Shift you from correct diagnosis. Shift you from correct strategy. correct planning at that time of manipulation. That, for example, okay, I should talk with the family and encourage them to increase social support, family support of the patient. And the family said that, okay, all the time we are supporting him. Decrease the trust of the family. Why do you think that we don't support the patient? We are supporting him a lot. But he said that you are not supporting. No, it's lying. But this lying decreased the trust. Because everybody thinks that the doctor should understand who lies, who doesn't lie. This is important. Psychological status. Anybody forget about asking about psychological status of the patient for sure to mark the interest. Because very important for planning a strategy. If your patient is depressed, you kill yourself and plan a lot of complex strategy. No treatment without improvement in psychological status. So, after these questions, again, any question from this part? After this, now is your turn. Start writing a problem list. It is very important that if you have a complete history, now you can list the problems of the patient. If you miss some problems, for sure your treatment won't be complete. Very important. Any problem in psychological status, any problem in habitual status. Sleep is disturbed, but you didn't ask. Any problem in the performance, the most important part of the history. Okay, what is the level of performance? You forget how you want to follow the patient. I told you, treatment is improvement in performance and psychological states. This is the treatment. So if you don't know what is the performance status, what is the psychological status, how you want to monitor the response of treatment, you are confused. You work on the hand and you see that, you say that, okay, I have improved the function of the hand. But you ask the patient, are you better? He say no. What is improvement in the mind of the patient? Improvement in performance, improvement in psychological states. Voilà. So you should ask in history that what is performance states, what is psychological states, and any problem in social situation. Again, you should mention that the patient lacks social support, family support. Also family history, the same problem in the family. Help you in diagnosis, some hereditary problem. In the past medical history, and the most important part, present illness chip complaint. All of the things you find as information should be listed in problem list. This problem list, we call it the clinical diagnosis. Clinical diagnosis. This is in your profile that you are writing. Next step, based on clinical diagnosis, localization. Which systems or which subsystems are involved, and the next step, etiologic diagnosis. Maybe we call it differential diagnosis. I talked this in past sessions. That, okay, in clinical diagnosis, you wrote the problem list and you reached this point that the patient is depressed. Depression is clinical diagnosis. What about etiologic diagnosis? Maybe this depression is because of some structural problem. Maybe because of neurodegenerative disease. Maybe because of a stroke, because of tumor. Not just functional disturbances of limbic system. Sometimes a structural problems leads to psychological problem. I had patient, his anxiety was because of encephalitis. So, remember, clinical diagnosis, in etiologic diagnosis, you should think about different causes of disease. We'll review together. Yes, you remember? What are different etiologic diagnoses? What types of causes can make neurological problems? If we want to categorize etiologic diagnosis,
Functional obstruction.
very good. Functional disturbances and structural two types. What types?
Neurodevelopmental.
Very good. Neurodevelopmental and
Obstruction.
destructive. Okay. This is what happens in your profile. Okay. Next step.
Treatment start.
Well, not at that time. Not treatment starts. Before treatment starts, what?
Treatment plan.
Okay, we switch to this one. Now, two things is important for you. Now you understood that you are in this state. And based on your information, you should be able to predict how much improvement you can make.
Doctor, you have differential diagnosis, I think.
Differential diagnosis is etiologic diagnosis.
But actually you pass examination.
Examination means neurological examination. Yes. But after this clinical processing, you want now to start your treatment. What you should do?
Plan?
Plan. What is plan? Planning. Before planning, I told you, you are in this state, you should be able to predict how much improvement, prognosis, exactly. How much improvement you can make for the patient. This is what the patient and the family ask you. You say that in the first session and you completely explain for them that we are now here after, for example, 6 months, after 1 year, I will try to make better communication skills, better academic activity or school activity. This is what you should be able to predict based on the situation of the patient and based on your knowledge and power, that how much improvement you can make for your patient. You will explain that. For example, after 20 sessions, we will reach to this one. Some patient for 3 years aphasia because of a stroke. Say that the prognosis is not good. Maybe I cannot improve much of the speech skills, but I will try my best during 1 year, continuous physiotherapy sessions. Maybe I can improve these skills in your patient. This is prognosis. An acute stroke, hemiplegia, say that because the size of the stroke is small, I will try my best that after 20 sessions, we can see that the patient can walk. This is prognosis. Prediction of how much improvement you can make for your patient. Very important in attraction and trust of the patient. Very important. This is prognosis. But for reaching to this goal, you should plan different strategies for the patient. And you should explain for the patient. I will do this strategy, this strategy, this strategy, this strategy for what? After 20 sessions, after 6 months to reach to this point. Explain which skills will be better. You can say that the patient will be more emotional, the feeling will be much more better, negative thinking will be improved, and these performances in these skills will be better. This is what the family expects you to explain. Most of the doctors say that it's not clear, maybe no improvement. So, negative thinking. And with negative thinking, you won't reach any improvement. It's not anything is accidental. You have this knowledge, you have this power that now we know what is the reason, which state we are, and if good prognosis after 20 sessions, everything will be solved. Or poor prognosis after 6 months, we will improve these skills. Not saying that nothing is clear. I don't know. So we should know that after 6 months, here is very, very, the people talk a lot. In Iran, the patient talks less. But here, patient talk complete, ask about everything. And I have seen that. The doctor doesn't answer anything. Just the patient asks, no answer. Not clear. What you want to do, I know my job. I will do, and let's see what. Okay, after 20 sessions, will be better? I don't know. If you explain for the patient, even if you cannot improve the force, but you can improve some performances, that after 20 sessions, we will be better in these fields. Okay, start. Thank you very much. And remember the last one. If you learn this session, you don't need anything more. The other skills you should get from the other teachers. You know why you are here. That during these 20 sessions, during these 6 months, please, before starting the next session, again you should have a reassessment. You should monitor the treatment response. Not after 20 sessions, you should, wow, why we didn't reach to this point, why no improvement happened. No, not after 20 sessions. For each session, you should follow the patient's problem list. Which of them is better, which of them no improvement. And if you reach to a point that why we don't go forward, again you should come back, and maybe you have missed something. I told you that most of the time, when you don't get enough response from physiotherapy procedures, most of the time it's because of psychological problem. Wow, the patient is depressed, that's why. And I didn't pay attention to that. I missed it. So maybe you have some procedures for depression. Maybe you want to refer the patient to the psychologist. So, if during treatment you monitor the patient and you didn't get enough response, maybe it's because of you have missed something. So, this is what you should come here and ask from the patient. But in addition to this diagnostic achievement, something which during taking history you should achieve. 1, a professional relationship and communication with the patient. Very important. And I will check if it is a real patient, or could you make this relationship with the patient or not? This is an art. You should show your charisma and prestige. Very important. I told you, if you come here and your patient here, what is your name? What is your job? You laugh, but you come here and you will see that at least 50% of you will be like, what's the next question? What is your problem? How long? How it's started? How long? Severity? And then, oh, I forgot that marriage. I said, are you married? So, a structure, fluent, discipline, charisma, prestige, and respect to the patient. Please, here sometimes I go and sit in the room and so sorry. The doctor, I will sit in front of me. Okay, what is your problem? Respect the patient, very important. That I should see that. Anytime, any patient come to my office, for all of them, I ask them, "Hello, how are you? Ahlan wa sahlan." Very important. Respect to patient is very important. Even sometimes I see that even doesn't look at the patient's face. Just like that, I can next patient. That's your problem. You should make communication. You should make professional relationship. What is relationship? What is relationship? You should give your phone number anytime you want to talk to you. No. Professional relationship. What is professional relationship? The patient understand that you have understood his feeling, his pressure, how much he is suffering from the problem. This is communication. And then you tell him that I understood, completely understood your problem. And now I have this plan to improve the situation. Completely trust you. Completely trust you. And this trust helps you in the process of the treatment. The patient cooperates with you. If you don't have cooperation of the patient, emotion. Okay, move your hand. Okay, move your hand. If he is emotional, try his best, you do your procedure. So, this is the most important part of your field, to learn how to communicate with the patient. So, when you come here, please, before coming here, have some exercises with your friend who should play the role of solution. Okay, we will talk, the patient will have a stroke, hemiplegia. Okay, which questions? You can use ChatGPT also, no problem. But you cannot write notes. You should remember that which questions you should ask from the patient. So if you have different types of etiologies, it will be better because for each taking history, maybe I give you some more information. So from next session, we will